When patients come in for an appointment, the first thing they say is, "Doctor, I have mastopathy." But it's important to understand what mastopathy actually is as a diagnosis. Mastopathy is a disease of the mammary gland. Mastopathy can occur with a predominance of the cystic component or with a predominance of the fibrous component. So it's important to examine these factors in detail in order to understand how to approach treatment correctly. Mastopathy usually presents as pain in the breast because the main cause of mastopathy is hormonal imbalance, meaning a disruption in the production of key steroid hormones. Specifically, in women, during the first phase of the cycle, there is active production of the hormone estrogen, and in the second phase of the cycle, the hormone progesterone. Before menstruation, the hormone estrogen actively affects the breast tissue, causing the breasts to swell and become edematous, and as a result, women experience a certain kind of discomfort before their period. This is completely physiological. She may not experience it, but as a rule, this discomfort is present. When a woman's period begins, the first, second, and third days of the cycle, the hormone progesterone replaces estrogen, pushing out the estrogen and returning the breasts to their normal state. So we are talking about hormonal imbalance. This means there is a disruption in the production between estrogens and progesterones. As a rule, this happens when the hormone estrogen predominates. Because of this, estrogen accumulates in the breast tissue, and a woman may experience discomfort throughout the entire cycle. That is, it may go away, it may appear. It's very individual. But it is important to remember that breast pain is usually accompanied by an increased concentration of the hormone estrogen. As a result, the breast may swell, it may become locally denser, and during this time, a woman may constantly experience some discomfort in her breast. These sensations can also be diffuse in nature, or they can be localized. Because of this swelling of the breast tissue, the milk ducts can become compressed and small cysts may form in the breast tissue. This is the so-called cystic component, which can be clearly seen during an ultrasound examination or mammography, if the woman is over 40 years old. Also, in cases of mastopathy, it is quite common for women to observe various types of nipple discharge. These discharges can appear clear, or they might have a distinct whitish tint. In some instances, they can even look greenish, brown, or red in color. However, it is important to note that red and brown discharge usually indicates a separate, more serious pathology. If you notice that these discharges appear, you should absolutely not wait for them to go away on their own, but rather consult a professional. It is better to consult a specialized doctor so that they can perform a cytological examination, take smears, and conduct a cytological analysis of these discharges to determine their nature of these discharges. Because the cause of the discharge may be elevated hormone levels, specifically the hormone prolactin, or the discharge may be due to a secretory disorder, and the cause of these discharges may also be intraductal polyps. Mastopathy, as a rule, when it does not have a nodular component, is treated conservatively. That is, first and foremost, patients who come in complaining of breast pain are required to undergo hormone testing to determine hormone levels and to develop a strategy for further treatment. At the first stage, as a rule, phytotherapy drugs are used, that is, herbal-based medications. At the second stage, we involve consultations with gynecologists and endocrinologists who then prescribe either hormone replacement therapy drugs or combined oral contraceptives to the patient. Surgical treatment is generally not used for the treatment of diffuse mastopathy or fibrocystic mastopathy. Treatment consists solely of conservative use of medicinal or pharmaceutical drugs.